The Civil War was a time of death and struggle for the soldiers. However, the shocking realization must be made that for every death on the battlefield, 2 died in the hospitals for multiple reasons, some being infection, disease, poor drinking water, and a lack of proper clothing. Due to this lack of proper clothing, poorly cooked food, open latrines, and contaminated drinking water, a consistent problem among all the soldiers in the Civil War hospital was typhoid fever, or diarrhea. No matter the problem the soldier had, once on the grounds of the Civil War hospital, the soldier was always subjected to this. The need for a doctor to wash his hands was not an evident realization either, and was not understood until much later. So many of the soldiers died from infections from improper treatment, rather than the original wound itself. The concept of dirt was a simple idea that was not even seen as harmful, so deaths were much higher for soldiers with simple bullet wounds, as they become infected by the doctor's hands or their surroundings. The medicine of the time did not promote healing and regeneration. As a solution for simple fractures and leg breaks, they were most often amputated in violent, horrible ways before the common use of painkillers. Anesthesia was just being introduced around this time. Many of the field hospitals were simply tents with a single surgeon cutting off limbs with an alarming rate without anesthesia and then throwing the limbs into a pile. Saws and other tools sporting medieval and menacing appearances, such as surgical scissors and clamps, were used to do these operations. The surgeons that knew how to perform these haphazard operations were not only medically misguided, but also few and far between. When the war broke out, there were only 115 surgeons in the United States Surgeon General's office. To add insult to injury, 24 of these left to form the Confederate Medical Services, who were in a far worse position. To support these doctors using already ineffective techniques, untrained male nurses were the people supporting much of the medical need. Inspections were done of the field hospitals of the Union. In 1893, inspections found that a total of 589 hospitals were rated as good or acceptable, while 303 hospitals were rated as bad or very bad. Of the doctors that were found working in these hospitals, 2,727 were rated good doctors, and 851 were rated as bad. It is easy to see the primitive natures of these hospitals, as doctors amputating soldiers without consideration for other options were often considered good for the time. 67,000 soldiers were killed in action, while 43,000 died of wounds. 224,000 died of disease, and 24,000 soldiers from other causes. There is no accurate estimate as to the death toll of the Confederate armies in the Civil War medical care. However, due to the lack of trained doctors, the numbers are assumed to be much worse for the South. Disease was a major issue for the hospitals during the Civil War. Though the soldiers were separated, diseased from non-diseased, shared bedding and containing bugs from infected soldiers often created an easier spread of disease and death. Due to this amount of disease, medicine was a commodity, especially for the South. Once the Civil War began, the Union declared medical supplies contraband to the South and created blockades to stop the Confederate ships from getting medical supplies. In desperation, the South relied on trade from European gain to the medicine they need. In addition, blockade runners were sent to look for supplies, and citizens were asked to provide medicine. Much of the medicine for the South also had to be made from native plants. 9 pharmaceutical laboratories were opened to create much of the needed product. The Civil War was a time of medical struggle, but the lessons we learned then will carry on forever.